Good day and welcome to Good Doctor. I am Dr. Bonus and I am here to discuss diabetes mellitus and metformin. What is metformin? To whom will it benefit from? Who are classified to take the medicine? And are there any side effects of metformin? Do you have any signs and symptoms of diabetes, including feeling more thirsty than usual? Do you urinate more often? Losing weight without even trying? Feeling tired and weak? Feeling irritable or having mood changes? Blurring of vision? Having slow healing sores? And getting a lot of infections such as in gums, skin, and vaginal infection. So what is diabetes mellitus? Diabetes mellitus refers to a group of diseases that affect how the body uses blood sugar or glucose. Glucose is an important source of energy for the cells that makes up the muscles and tissues. It is also the main supply of the brain. The main cause of diabetes varies by type, but no matter what type of diabetes you have, it can lead to excessive sugar in the blood. Too much sugar in the blood can lead to serious health problems. What are the symptoms? Diabetes symptoms depend on how high your blood sugar is. Some people, especially if they have pre-diabetes, gestational diabetes, or type 2 diabetes may not have symptoms. Type 1 diabetes can start at an early age, but it is often during childhood or teen years. While type 2 diabetes, the most common type, can develop at any age. Type 2 diabetes is more common in people older than 40 years old, but increasingly, type 2 diabetes is seen in children. These symptoms include polyphagia, polydipsia, polyuria, and sometimes irritation in the skin. What are the main causes of diabetes mellitus? To understand diabetes, it is important how the body uses glucose. How does insulin work? Insulin is a hormone that comes from a gland, which is named the pancreas. The pancreas releases insulin into the bloodstream. While the insulin circulates, letting the sugar enters the cells. Insulin lowers the amount of sugar in the bloodstream. As the sugar level drops, so the secretion of insulin from the pancreas. The role of glucose. Glucose is a sugar, the main source of energy for the cells that make up the muscles and other tissues. Glucose comes from two main sources, including the food and the liver. Sugar is absorbed into the bloodstream, where it enters the cells with the help of the insulin, while the liver stores and makes the glucose. When the glucose levels are low, such as if you have not eaten for a while, the liver breaks down the glycogen into glucose. This keeps your glucose level within a typical range. The exact cause of the main types of diabetes is unknown. In all cases, sugar builds up in the bloodstream. This is because the pancreas does not produce enough insulin. Both type 1 and type 2 diabetes may be caused by a combination of genetic and environmental factors. It is unclear what those factors may be. What are the risk factors of diabetes mellitus? Risk factors for diabetes mellitus depends on what type of diabetes you have. Family history may play a part in all types. Environmental factors and geographics can add to the risk of type 1 diabetes. Sometimes family members of people with type 1 diabetes are tested for the presence of diabetes immune systems, or also called autoantibodies. If you have these autoantibodies, you have increased risk of developing type 1 diabetes. But not everyone who have these autoantibodies develop diabetes. Race or ethnicity may also raise a risk of developing type 2 diabetes. Although it is unclear why, certain people including Black, Hispanic, American Indian, and Asian American people are at higher risk. Prediabetes, type 2 diabetes, and gestational diabetes are more common in people who are obese or overweight. What are the complications if you have diabetes mellitus? Long-term complication of diabetes develops gradually. The longer you have diabetes and the less controlled sugar you have, the higher the risk of these complications. These include complications in the heart, blood vessels, nerve damage from diabetes, kidney damage, damage from your musculovascular, eye damage, and foot damage. How do you prevent diabetes mellitus? Type 1 diabetes can be prevented, but with the healthy lifestyle choices that can help treat pre-diabetes, type 2 diabetes, and gestational diabetes can also help prevent them. One tip: eat healthy foods. Choose foods lower in fat and calories and high in fiber. Focus on fruits, vegetables, and whole grain. Eat a variety of these foods to keep from feeling bored. Get more physical activity. Try to get 30 minutes of moderate aerobic activity on most of the week. Lose excess pounds. If you are overweight, losing even 7% of your body can lower the risk of diabetes. Some drugs are an option. Oral antibiotics such as metformin may lower the risk of type 2 diabetes. But healthy lifestyle choices are important. If you have prediabetes, have your blood sugar checked at least once a year to make sure you cannot develop type 2 diabetes. What medication can treat diabetes? Metformin. Metformin is an anti-hyperglycemic medication used to control high blood sugar levels. It is preferred the first-line treatment of patients suffering from type 2 diabetes. It helps reduce diabetes-associated complications such as blindness, kidney damage, nerve damage, stroke, and heart attack. It is also used in the prevention and treatment of PCOS or polycystic ovarian syndrome. What does metformin contain? It contains metformin, which belongs to the class of anti-diabetic drug biguanides. Metformin is a Food and Drug approved anti-diabetic agent used in the treatment of type 2 diabetes. It is often used as a single drug or in combination with other anti-hyperglycemic medications. It is also effective when in combination with healthy exercise. How does metformin work? In the management of diabetes, it works by decreasing the production of glucose in the liver, decreasing its intestinal absorption, and increasing the body's response to insulin. It lowers the baseline sugar level and blood sugar level after eating. Who cannot take metformin? This drug is not generally recommended to all, but if you are having these complications, tell your doctors immediately. First is allergies to metformin, patients having type 1 diabetes, patients with kidney failure or filtration rate of less than 30, patients with severe infection, dehydration, and shock, having acid-base imbalance in the body or metabolic acidosis or ketoacidosis, patients having lung failure or blood clots in the lung, or patients being treated for heart failure or recently had an heart attack. How should you take metformin? The drug is an oral medication, typically dosed from 500 to 3,000 milligrams per day in divided doses. Take this drug at a dose, frequency, and duration advised by your doctor. Follow your doctor's order or direction on the label. Your doctor will check your blood sugar regularly and may increase the dose as necessary. What are the side effects of metformin? The drug is generally safe and well tolerated. Gastrointestinal symptoms are the most common side effect, occurring in 30% of patients taking metformin. These include diarrhea, nausea, vomiting. Inform your doctor if you are taking steroids and contraceptives. This affects how your body handles sugar. Your doctor may need to check your daily lifestyle. Diet and lifestyle is also important in treating diabetes mellitus. To work properly, the amount of metformin you must take must be balanced against the amount and type of food you eat. and the amount of exercise you do. Cut down food that are high in added sugars like sweets, cakes, juices, and fizzy drinks. Avoid foods that contain Carella, which lowers your blood sugar levels. Avoid skipping meals as it interferes with the balance of sugar and insulin in the body. It can lead to dangerously high or low blood sugar levels. So for quick tips, your doctor will regularly monitor your blood sugar level and kidney function. If you are using this drug on a long-term basis, your doctor may need to check your vitamin B12 levels and carry a sugar source like candy around if you need an immediate relief of hypoglycemia. So that's it. I hope you have enjoyed our video and learned something. I am Dr. Bonus, leaving you a tagline: eat healthy, live healthy, and live longer. More information, please like, subscribe, and hit that notification bell so you don't miss any of our videos.